I'm just going to give it one more minute. Looks like we have about 20 people who have joined us so far. And I will do a really quick introduction. I want to make sure that I give the time over to Dr. Young of the Assisi Foundation, and also give those who are participating an opportunity to ask questions. So at 10:02, we'll get started. And as you're entering, if you haven't already, I do request that you just check and make sure that you have a red microphone with the slash through it, and that indicates that you are muted. All right, 10:02 came pretty quickly. So thank you all for joining us today. I'm only going to take a few minutes just to talk about what we're doing and how we have started our technical assistance training. As many of you know, we are now in the implementation phase of EHE ending the HIV epidemic here in Memphis. So throughout conversations that we've had with the community and with our subcommittees, it was identified that there needs to be some trainings, some resources and opportunities to help these small nonprofit organizations, grassroots organizations, and larger organizations who have an interest in going for the funds for EHE to submit a strong proposal when we are prepared for the RFP to be released, hopefully in June. So just to give you a little background, we have Dr. Jan Young from the Assisi Foundation. And in the meeting last week, I asked if she wanted me to highlight any of her accomplishments. And she was so humble and said, no, we don't have to do all of that. But I'm a millennial, so I did a little research. And I didn't know, but I found out that she has a background in education in her career. And she's military, and that makes a lot of sense because she's very structured, and I love that about her. And she also has her partner, Ernestine Berry Smith, who is a senior programs officer at the Assisi Foundation, and she helps to host the Before You Ask classes and the Before You Serve courses. And I do encourage everyone who is participating in this session today to go and look on the Assisi Foundation website, look at the different trainings that they offer, and if you see that there's an opportunity for you to participate and there's some information that you want to learn a little bit more about, then go ahead and sign up for those courses and those trainings when they are available. So I don't want to take too much time, but I do want to share with you all that as Dr. Jan goes through the presentation, she's going to give an overview of topics related to preparing a great grant proposal. So there won't be a lot of detail as we are continuing these sessions, and there will be more opportunity to talk about specific topics like evaluations, how to operate a strong board, budgeting, and things like that. But we don't want to take away this opportunity for you all to ask her direct questions. So if you have questions, feel free to place your questions within the chat box that we see on the right hand of our screen. I will read the questions to Dr. Jan. Sherry will help me by letting me know if it's something that I've missed. And then I know we have a lot of people on here who are extroverted like me. So once we get to the end, we want to give you the opportunity to unmute yourselves and ask some of those direct questions after the presentation. Dr. Jan also shared with me that if we don't get to your question today, that she is willing to share her contact information, email, so that you all can ask her questions directly. And we know sometimes after a presentation, you may think about something and you have the opportunity to talk with her afterwards. So I'll end right there because we know I can say a lot. And I want to introduce Eddie Wiley. We know him as the EHE coordinator from the Tennessee Department of Health, and he just wants to share some greetings. So go ahead, Eddie.
Good morning, everyone, and thank you, Aisha, and thank you to all of you who are joining us today. We are so thrilled about this TA series from the Tennessee Department of Health. As you know, as Aisha said, we are gearing up for we're in the implementation phase, y'all. So we are gearing up for the EHE Advisory Board. So please contact us if you are interested in that. And we will be releasing the RFP. So as Aisha mentioned, this is really to get some ideas to strengthen the innovation that is around here for the EHE efforts. And so we wanted to take part in this TA series before the RFP was released, so that way questions can be answered, ideas can be shared, and resources can also be shared. So again, thank you to Dr. Young and the Assisi team, and thank you again to all of you that are here today.
Perfect. Short, sweet, and to the point. So now we will give it over to Dr. Young, and I hope that you all enjoy the information that she's sharing today. I know you will. So we can pass it to you now. Thank you so much.
Okay, so can you see the screen? Great.
Yes.
Eddie, I was so hoping that we would have the RFP already released so that we could make this specific, but I understand. So today we're going to talk about responding to the request for proposal. It is a very basic overview, just like Sherry and Aisha have told you in all the correspondence before today. And so let's start out with expectations. So today we're offering this as food for thought, additional tools and resources, and maybe some missing pieces of a puzzle for you. The presentation isn't the keys to the kingdom or the recipe for a guaranteed grant or a favorable response to the RFP, but we can really make them work hard. So what's the basic elements usually of an RFP? We see the project, the scope of work, evaluation criteria, and submission requirements. We don't have the specifics because, as you know, the RFP hasn't been released, but we can guess what they're probably going to be. Now, before you write the response or proposal, we're going to do our homework. And that is so important, and it will save a lot of grief and a lot of time later. So, read with care. It's so important to read everything with great care. There's so much information that we can see or, miss if we don't. So we have to pay attention to all the requirements. We don't want them to throw away your response because we didn't meet the requirements. The format is very important. Some reviewers get really hung up on format, and we don't want anything to take away from your points. The process is important. The deadline, critical to meet the deadline, and very important for it to be very clear how you will be paid for the work. How much time will it take for you to be reimbursed for the services you provide or anything that you provide? So during the process of this presentation, I'm going to ask some of you, even though we're doing an 8-hour workshop in 2 hours, I'm going to be asking some questions of some of you, and I know that you'll help me out by participating. So are there people in the group that have already responded to RFPs in the past? How many of you have had experience with that? Would you put that in your chat? So several? Okay. If you've ever responded, and Rosa, thank you, I see that you have. If you've ever responded to an RFP or applied for a grant, I want you to know what your competition is. So if we look at Memphis, if we look at Shelby County or our region, you'll see on the top row the total number of nonprofits that are registered. And you'll see the total assets for each one of those nonprofits. If you look at $12 billion of income for 11,419 nonprofits, for a population of 651,000 individuals in Memphis, wouldn't it make you think perhaps that, where is that money going? So if we just did simple math, which we know doesn't usually represent what actually happens, there's not a single person living in our community that should not have had services from a nonprofit. And that's why it's so important to understand. So let's drill it down further for this RFP. So according to the End HIV 901, and I'm going to trust that that information is up to date and current, and you will be able to tell me if it's not, because many of you are in the room with us today by Zoom. We have 40 providers, and I don't know if all these numbers are unduplicated. It's just what I could find that serve with care and treatment services. Some 40 that offer testing, 23 that offer prevention services, 20 that offer support services. So for those of you out there today, I put in HIV miscellaneous, and I added that so we can kind of think about what might those other things be. If we're going to end the HIV epidemic here, what do we have to have beyond care and treatment, testing, prevention, and support services in order to make it happen? Could you write something in the chat, please? And I don't mind if you unmute and say something. Sherry might get after me for that, but it's okay. Anybody? Mental health providers, yes. So very important, thank you. Anybody else? Education, yes, Ray, thank you. Anyone else? So obviously there are many other things, and we're going to talk about a lot of those social determinants later, but you're absolutely correct. We need more than just this to end the HIV epidemic. So here's what a funder sees. You know that last slide that we looked at with all the number of agencies that are registered nonprofits in our community? We see this competition, everybody pulling for the same finite dollar. Now here's what an applicant sees. Oh, we're going to get a blank check from that funder. It's like an ATM. Oh, we're going to get piles of money. Oh, it's going to be like Christmas. So all you're seeing is money, money, money. And so that's what we hear. And you know what? In between what the funder sees and what the applicant sees is the reality. But basically what you want to know is, how does my nonprofit get a piece of this pie? Because you really want to know, okay, how do I get this? So my question to you is, what pie? You know, if it's true and accurate that the funding from the state will be $2.5 million, and we've all heard that figure floated around. If it's true and accurate that there's 6,500 cases of people living with AIDS, is that true, by the way? Can somebody put that in the chat for me if that's pretty accurate or not? Or somebody shout out anything?
That's very close.
Okay.
Yeah, I think
Thank
the
you,
number is
Aisha.
6,723 in Shelby County.
Thank you, Dwayne. Okay, so if we do the math, whether we use the 6,500 or the 6,700, if we took that $2.5 million for whatever the duration of the grant or the proposal will be, that's only like $380 a person. I mean, come on. What are we going to do with that? Can we really end the HIV epidemic in our community by giving each person living with AIDS $380 something? Probably not. So what do we have to do? Okay. Well, hopefully you have paid attention to what your planning groups have done. And so who are the partners that we can get in Tipton, Shelby, and Fayette if that's our planning group? So if that's our planning group, and you know better than I who are the most reliable people within the group with whom to partner, we'll probably have to reach out, won't we, if we really are serious about executing the plan. So part of the homework that we have to do going after any of this funding is to say, okay, I have to understand this plan. And if I really believe that this plan is going to work, I have to make sure that I have the right partners with me to make it happen. So here are some basic questions to ask yourself. First, look at the criteria for the RFP. Do you meet the eligibility criteria? Do you have the capacity? And by that, I mean the leadership, the staff, the technology, and other resources even to respond. Now, just because you don't doesn't mean that you cannot apply. You can apply with a partner if you don't, but it's important to be honest about your assessment. Will you need to partner because of what you found in those questions that we just asked? And if so, who is or who are the right partners for your work? So then what? Okay, another thing the funders look at is this. For example, tell me, if you don't mind putting in the chat, how many of you are in organizations that have assets at the end of the year of $250,000 or a revenue of $250,000 a year? And while you're doing that, while I'm looking for it in the chat, some people will only file a 990N because they only have $50,000 in receipts a year, and that's okay. And so, you're just starting out, you're a new organization, and that's what you have. For others, if you're between $100,000 and $250,000 in receipts, well, you file a 990EZ. Rest of the folks file that, but typically in a group, who might be, other than St. Jude, obviously, we'll discount St. Jude, but of the other organizations participating, where do you typically fall in terms of the total amount of income that you have as an organization every year? Anybody? What does the chat say? Do you know? If
I'm
you
not
don't
sure.
know, it's really important to know when you're filling out a, Aisha, were you going to say something?
No, I was just sharing that I hadn't seen anything in the chat just yet.
Yeah.
Okay, so if you don't know, it's okay. The reason it's important to know is there's a thing that the IRS calls tipping. And so there's a way that a charitable organization can get tipped out of nonprofit status if they provide a grant to you that exceeds what is called the public support test. And that might require further explanation and for me to send additional information. But this is part of doing homework. I realize that sometimes people don't share this type of information and you have no clue why you got no response to your grant request, or why it just got thrown in the trash, at least in your mind, or that, you got an automatically no, you're not going to get the grant. Well, that may have been the reason that you didn't get it. You may have done everything perfectly well, but the amount that you requested exceeded the amount that you could get based on the amount of income that you have as an organization. Okay, so what are reasons to be concerned when you're doing the homework for your organization? Well, obviously, eligibility. If you are an organization providing services for people living with AIDS, obviously it's a fit to mission, right? But do you have the capacity in terms of the infrastructure, the people that you have on staff, the amount of funding you're going after, and the timing of the funding? Because let's say, and this is why it's important to have a discussion with your accountant or CFO. So if you don't have much capacity in your budget as an organization, or your income comes sporadically because you're waiting for the gala or whatever, can you afford to do the services you're committing to do and then have to wait an additional 90 to 120 days for you to be reimbursed for the work that you did? So if you don't have any reserves on hand to take care of your staff or take care of other things that you've committed to do as an organization, that can mess you up really badly. So if you're in doubt about that, don't apply. Additional reasons to be concerned. Unfortunately, like any organization, even with nonprofits, as much as we may love everybody and love each other, there sometimes can be dysfunction and disagreements. If you're going through that as an agency, that's probably not the right time to apply for a grant. If you're not ready, wait for another opportunity. Stand up and be a partner for somebody else. If for some reason you can't meet the requirements, or find other funding so that you can meet the requirements, that would be a reason to be very concerned. if you're really close to the deadline. Some people do exceptional, masterful work because they like that adrenaline rush and they really want to do something, and they have to wait until they're at the 11th hour before they can sit themselves down and actually do the work. A lot of times, those are the times that we make our biggest mistakes that we would not normally make if we had taken a little bit more time. So that's another reason to be concerned. Also, be honest in assessing your competition. Maybe they are better qualified to do the work, and maybe your role can be one of support. If there's going to be a leadership change anytime in the near future for your organization, this may also be a time to really think through, is this the time to go after a major grant? Okay, so we've talked about the reasons to be concerned. Now let's move into writing the response. So here's the basic guidance. You've read the fine print, you're following the instructions. Avoid jargon. There's language that you use because it's just second nature to you. But the person reviewing the grant or the response may not be familiar with the language that you're using. So try to avoid acronyms no matter how common they are. Be sure to check for typos and grammar errors, and you want to be concise and be complete, because there's usually within the format and the requirements for the response that you limit yourself to only a certain number of words or characters for the narrative if you're using an electronic portal. So follow the instructions. And it is heartbreaking to see how many excellent proposals do get thrown away or discarded because instructions have not been followed. So my best advice as the broad overview is to keep it simple. And the way that I like to work with it is, no matter how fancy the resources are or the guidance can be from multiple wonderful sources, we have the who, what, why, where, when, and how. If you can answer all of those, you will be able, anybody can write a grant if they can answer those basic 6 questions. So just keep it simple. And it is a truth. People only fund proposals they can understand. Now, there are times that they'll say, I'm just so confused, they must be doing good work, fund it. But those are rare instances. And unless you're St. Jude and you have the scientists presenting complicated work, you can't usually get away with that. So keep it simple. Due dates are closer than they appear. There have been some exceptionally talented people who have not presented their best proposal because they waited too close to the deadline. So it's almost a blessing that the RFP hasn't been released yet, because you have a little bit more time to really deeply study the plan with your planning group and with our region to see how you fit. Now, should you hire a grant writer? These are the 4 basic questions that will probably help you with the most. The pros of hiring a grant writer, the why you should maybe. If the grant writer has specific expertise, so you might want to check references, you might want to check the quality of their writing, if they can really communicate what you want to say. And because most of you are knee-deep in alligators doing your day-to-day work, carving out time to write a great grant or response to a proposal can be very challenging. So that's on the side of, okay, maybe that's why I should hire a grant writer. So on the other side of that, does that person really have complete knowledge of what you do? They may have exceptional knowledge about how to write a grant, how to make sure all the I's are dotted and the T's are crossed. But they may not understand you. They may not understand the individuals you're privileged to serve. They may not understand how things work within the system, and they may charge a whole lot of money and still not deliver a successful grant. And so those are things you have to consider. I believe everyone that we have with us today does have the capacity to write a great grant or response to a proposal. It's just, do you have the time to give the proper attention to it that it deserves? So the who part, because we thought we'd go through the who, what, when, where, why, and how. The who part is the history of the organization, your background information, the reason you were created, and what your core business is. And by core business, exactly what is it that you do every day that you are committed to do because of your mission? That's your core business. That's why you exist. Okay, so that's easy, right? Or should be easy, because we should all know who we are, right? If not, if we have an identity conflict, that's problem number one. We don't want to go further. Now, we looked at the amount of money, we looked at the region, we looked at the number of people living with AIDS. So we might have to have a partnership. And there's a thing called fiscal agent. Because of the amount of revenue we have as an organization, we might have to reach out to a fiscal agent, because in order to get a certain amount of funds, maybe we want $100,000, $250,000, and we haven't yet filed a 990 EZ even. We're still filing a 990N. So we might want a fiscal sponsor. There are differences between a fiscal agent and a sponsor, and I can send you a handout on that. One, if you get a fiscal agent, the amount of funding, depending on the way things are set up, may not be tax deductible for the donor. So that might affect whether or not they want to help fund your organization or project. And then we need to look at, is this going to be a cooperative request where we have an agreement that another agency does one thing and you do something else? And if you decide that you're going to do that, make sure that there's a match between your mission. Hopefully, since we're working in the same interest and subject area, that's easier than with other grants. We have to look at what other partnerships are going on. And, sometimes it's a temptation because we're nice people and people say, oh, will you help me? Will you be my partner? And they'll go, oh, sure, I can help. And then somebody else will come the next day and say, oh, can you help me? We've been in the planning group together, and you say, oh, okay, I can help. Be careful, because you don't want to spread yourself too thin, and you want to make sure that you're able to honor whatever commitments you make to anybody. And so make sure that we have clear agreements, even though you love everybody else and you think that everything's kosher and everybody understands each other. Make sure those agreements are clearly established and in place at the time that you respond to the RFP. We don't want any hurt feelings or people getting upset with each other. The work is too important, and we're all needed in the work in order for it to be successful and for us to really end the HIV epidemic here in our community. So we have to be accountable, and that's so important, and that's why we need to have those clear agreements in place if we're going to be successful in this effort. So the what? Okay, even though the broad picture is to end the HIV epidemic, what is it that you are going to do or you will do within your partnership? Is it a program? Is it a project? We have to be really clear about the purpose for which the funds are requested, whatever the amount is and what you're asking for. Now we get to the when, the why, and the where. The when is the timeline. So, okay, when is the RFP? When's the deadline to respond? When will you get some kind of response, whether you received it or not? Where must you do the work? Does it have to be in Memphis, the city of Memphis proper? Can you go into the county? Or how much latitude is it to go into the tri-state region of Eastern Arkansas and Northwest Mississippi? We know that based on geographic patterns of movement and where people live and play and work, that, we might need to pay attention to East Arkansas and Northwest Mississippi, but we still want to make sure that we're taking care of Memphis and Shelby County, right? But we have Fayette and Tipton too. So do we say, okay, if you're in Crittenden County or DeSoto County, we can't play, not with this RFP, but we can only play within Fayette, Tipton, and Shelby. That's just all the where answers that you'll have to give. And with the why, obviously you want to link to your mission. You want to be able to say, when somebody says, okay, you're going to do whatever, and some smart alecky person says to you, so what? You're going to do what? So what? What difference is it going to make? At that point, you're going to have to say, okay, here's the value. Here's how I know that it's going to not be just a nice to do thing to end the HIV epidemic, but it's by golly the right thing to do. It's a must do. And guess what? It's going to be impossible to do without me. So your organization, the more that you can go down that list in your case statement support, if it is impossible to do without you, then you are making the strongest case possible that you must be funded as part of this work. Now, according to End HIV 901, these are the pillars that you'll be working around. So if that's true, it should be very easy to see where you fit. And in the HIV continuum of care, we go from diagnosed to receipt of care, retained in care, viral suppression, and linked to care. You may or may not agree with that continuum. You may have many subcategories to add. For example, retained in care. I think, was it Rosa who said mental health providers? Someone said mental health providers. Maybe we need those mental health providers in order to make sure that we're retained in care. So that's so very important, right? Okay, so here are typical healthcare factors. Anytime we're dealing with healthcare grants, research opportunities, or whatever, there are two things that come up: economics and behaviors. So in economics, we look at, is the service available? Okay, even if the service is available, does my client have access to that? Does my patient can access it? And what might be a barrier to accessing the service? Might it be cost? And the cost could include the cost of transportation. It could be the cost of medication. It could be any number of things within that cost. What is the quality I can expect? If I go to your agency, do I know that I'm going to get the best quality care? Can I send someone that I care about to your agency to get that quality of care? And is it an effective, efficient process? Or, might it come where, yeah, I got good quality, but it took 3 years to get it done? No, I need help now, right? So that's going to affect my perception of quality, right? Or the of those we're privileged to serve. What are the behaviors? Now, we know that we look at the economic factors. Most of those are typically related to institutional practices, public policy, infrastructure, whatever. The behaviors obviously can be affected by an individual. Maybe that individual has had negative experiences with the healthcare system. Maybe that individual has issues of concern about, being exposed as someone with HIV. There's maybe the individual feels that they will be stigmatized or mistreated. Then we have institutional behaviors. How do we treat those living with AIDS? I can remember way back in the dark ages when, as a nurse, I had my first patient who had been diagnosed with AIDS. You should have seen the type of garb we had to put on to get into the room and then to take care of our patient. And then, the fights we had to have with people just to deliver food and just getting basic care done. Some housekeepers didn't want to go into the patient's room. It was very, very difficult. In another institution where I worked, we had an individual who said, if, that person arrests, I'm not going to do CPR. And, I mean, we were dealing in the dark ages, as I call it, the early days of the epidemic, with a lot of misinformation, with a lot of fear, with a lot of issues that we don't have to, thank goodness, deal with today. But we still have institutional behaviors and policies that deserve to be changed. And then, of course, we have the infrastructure of the community. We had a board member one time who called me, and he was so upset. He said, "You're going to have to find somebody." This couple down the street, I thought they were nice people, but they're making their son live out in the carport because he just got diagnosed with AIDS. So, I mean, I understand that's been many years ago, but still, I remember it. But, as a community, there are some things that we still have work to do, right, in communicating. And then what are the policies that get in the way of us being able to provide the best possible care for people living with AIDS? Those are things to consider. These are things that deserve to be addressed. And I'm trusting that you've outlined them in your plan. So let's talk about the social determinants, those other factors, those things that should have been included in that line called HIV miscellaneous. Food insecurity, lack of transportation. Does this affect only people living with AIDS? No, it affects other individuals in our community, but we know that people living with AIDS often experience this to a greater degree. Housing insecurity, geographic and racial context, even in places where people are privileged to reside, which may take them further away from healthcare resources. The lack of health insurance. Maybe they have health insurance, but it's not adequate health insurance. The education status, the level of literacy. Even people with PhDs can be functionally illiterate in some areas of healthcare. We have religion. We live in a Bible Belt. We have different beliefs and culture and norms that are part of different religious denominations. There's the stigma, the trauma, poor mental health resources, people who may not know how to adequately treat people living with AIDS. We have substance abuse that's part of the journey, and then social disparities. And I think actually End HIV 901 writes that determined as social injustice. I just changed it a little, but the message is the same. So in order to map out social determinants, I put this slide up. I know it's an eye chart. The reason I did that is because I'm sharing the slides and I want this to be a handout. But this is a wonderful resource for people who don't know it. I'm sure all of you do know it, so that you can pull data that might be helpful in creating your response. Or certainly, I'm trusting that the planning group has pulled the data so that you can look at the data more completely. So the how. The relationships with other organizations will be important. How you map your implementation strategies, the accountability and assigning the roles that people will serve in responding, the costs associated, the evaluation that you'll do, your capacity and resources, either individually or with your partners. Make sure you build in contingencies. Life happens. I don't expect you to write in a contingency like for the pandemic. My goodness, who could have written that contingency, right? But please think about other contingencies that you might need to have. And also, nobody likes to hear it, but the way that the nonprofit sector is created in our country, we do need to worry about sustainability. Funders typically don't write organizations in their line item budget. And so that's really important. The amount of funds for this particular RFP will be capped at a certain amount. So we have to look, because the worst thing we can do is to be 75% complete in our journey to end the HIV epidemic and not be able to go the rest of the way. So one of the things that I provide as a handout to people, this comes from the Total Quality Management, Continuous Quality Improvement work. It's called an Ishikawa-Fishbone Diagram. Sometimes people have difficulty saying, okay, I have a problem right here. So what is it that I really need to make sure that I have in place to make sure I've addressed all the things that could affect that problem? Now, I'm not saying that this is a tool that will work for everyone. It does work for some. I like it because it forces me to think about other things that I may not have thought about in trying to get to problem resolution. So, I offer it for you if it might be helpful. You'll be getting further instruction on writing goals and objectives. Most people like to do SMART goals, which means they're specific, they're measurable, attainable, they're relevant, and time-bound. And that will all be essential, but you'll be getting more in-depth about this in a later session that will be devoted to writing goals and objectives. The other thing that you'll be getting more work on and more experience with as you go through the technical assistance series with Aisha and Sherry is the budget. Now, some people get really wigged out about the budget, like, oh my God, I don't know if I can do that. Well, basically a budget is simply sources of funds and uses of funds. So if the RFP says you have to follow a certain format, follow the format. If it doesn't, use the format that you use for your organization. Just make sure that it's accurate, that you're asking for sufficient funds or can get sufficient funds from other donors, plus what you're asking from the RFP. Make sure it's realistic. The truth is, I'm not sure that we can end the HIV epidemic with $2.5 billion. But I believe that those funds could be leveraged to end the HIV epidemic. And if you didn't believe it, you wouldn't be going through this process. Make sure that you justify your budget so that, we know we have every reason to believe that the dollars won't be wasted. Find other donors. If you really believe in this, it's not about the RFP. It's about getting the job done. And so we're going to have to find other donors, right? And we're going to have to address the issue of sustainability. People don't like to talk about that, but you deserve that. If you're going to continue to do the work, you have to find a way to do it. There's an expression called no margin, no mission. You can't do the work if you don't have the resources to do it. So for people who have difficulty thinking about, well, what do I put in sources of funds? This will be in your handout, your copy of the slides, just giving you kind of usual things that people put in sources of funds. Here's another list of uses of funds. There's many more things, but this might trigger your thinking about what to put in those sections. And then evaluation. Again, you're going to have an in-depth session on evaluation, but of course, we're going to go through it today as part of the basic overview. It doesn't have to be expensive. It doesn't have to be complicated. It doesn't have to be time-consuming, but it does require time and attention. So here's the evaluation criteria, and you want to have an evaluation in your response to the proposal. So you'll have to follow the criteria, of course, but then you want to know, what type of evaluation am I going to do? Well, the planning part's probably already done, right? But you might need to have a sub-plan, right? And is it going to be goals-based? Is it going to be process-based, outcomes-based? We're going to talk a little bit more about outcomes because that's more difficult. Cost benefit. Are you going to say that my way of doing things will be more effective or less cost to greater benefit of the individuals being served? What methods are you going to do? What types of data? How am I going to analyze it, and how am I going to report on it? Those are all things that will be necessary to answer before you write that into your RFP. Now, we're going to talk a little bit more about each one of those. So here's levels of program evaluation. It can be reactions and feelings. It can be whether someone learned, there's a change in skill sets, and effectiveness. So those are the basic levels. Here's the logic model. We're not going to go through each one of these because that's a lot, but the reason the logic model is there is if you want to know what to put in what category of your evaluation that you create, then here it is, right? You can look at this and you can say, oh, okay, this is what I can use to help guide what I'm going to create for my evaluation. Now, another way that you can do it is through dreams. And the reason I selected dreams is because this is specific for HIV. So it shows you what a program did to the extent that it might be able to inform the way that you might want to approach your particular strategy or project or program. This one is for reducing new HIV infections. And so they give you the context, the interventions, the outputs, the desired outcomes. And so it's laid out very clearly, and this is what the organization is going to say, I will be accountable for creating this. And some of you may already be using the DREAMS model. Here's another representation. This one is for HIV prevention and management, and you have the reference document at the bottom, but it tells you about the actions, the outcomes, the intermediate outcomes, and public health outcomes. These are only offered not for you to use verbatim, but for you to use to stimulate thinking and as a way of getting an idea of how to write your logic model. Here's another one from Dreams for girls and women to reduce risk. Very interesting group that they do. It's a global health initiative. So again, it's provided only as a tool and as a reference document. So evaluation methods can be questionnaires, surveys, and checklists, interviews, documentation review, observation, focus groups, and case studies. Now, I really miss having you guys in a room because we'd be having a whole lot more fun instead of you listening to me as a talking head, because we would have interaction. So I miss it very much, but I appreciate your indulgence of doing this way. So what are the measurements? Well, we can measure program to expense ratio. You want to know how you're going to measure results, whether it's short-term, long-term. Always select the right tool. Test it and say, okay, if I use this tool, will it get me the answer I want? So the first thing we usually talk about is outputs. So outputs are like results. If the outputs counted don't lead to anything meaningful, the results are meaningless. So that's, so like, okay, if you educated 100 people, but you don't know what happened, then, it's really meaningless that we educated 100 people, right? Okay, outcomes are more difficult to measure. So if we really want to claim something as an outcome, we have to say it was a result that was observable, and because we did that particular work or provided that particular service. That's harder to measure, and we're going to do a little exercise. Okay, so with outcome, the change happened because of the activities of the nonprofit. So we'd have to say the degree to which new HIV infection rates decreased because of specific activities provided by your agency or your partnership with agencies. But we'll have to figure out a way to prove that, right? That's why you're going to go back to the logic model so that you can have a higher likelihood of being able to provide that proof. Okay, so then impact. Impact is like This is the standard. So this is usually longer term. And we want to say the outcomes claimed by your organization are directly attributable to your activities. People who are in research can do this a lot easier than those of us who are doing human services work, because we have all these interdependent relationships that get in the way of being able to say, yes, what we did actually created that. So it's very difficult to measure. Sometimes what we go for may or may not happen. It does require a different form of analysis, and we have to prove that the changes were directly linked to the efforts. So it is the gold standard. Now, I would like you to try to chat and tell me what is missing in this. So we want to decrease the incidence of new HIV infected young adults at XYZ school in South Memphis. So that's pretty clear, right? So by the end of year 1, we want to provide young adults in South Memphis at XYZ school with a 2-hour training program that will provide information about HIV and STD transmission. So it's specific, it's measurable, it's attainable, it's realistic and time bound, right? Most of the agencies represented today can do that, right? So what's missing from this evaluation method? And please, somebody put something in the chat so I know that you're still with me. Instructors will track the number of young adults who received the training, when they received it, and where. So what's missing? Anybody? Amber? I appreciate you putting something in the chat. Okay, race, that would be a factor, Rico, that Ray Rico, we could absolutely look at. What else? You know, you can't get a wrong answer. So don't be afraid to put something in the chat. How will it be measured? Okay, so that's a great question to ask, because we're saying, Now it says we'll track the number who received the training, when they received it, and where. And that may not be as specific as we want, right? What else? Thank you so much for sharing those. Okay, so let's dissect it a little bit. Let's not put you on the spot like that. Okay, if we said 100 young adults in South Memphis were provided a 2-hour training program on HIV and STD transmission in calendar year 2021, that's a result. But what we didn't say is how old they were or where in South Memphis they were. And we may have not have put in, we sure didn't put in who provided it. We're going to assume that we should never make assumptions, but the assumption is that your agency provided. But, you know, you do get credit for doing the training. And, you know, young adults, hopefully you have a record of everybody who did it. But typically when funders and people who review proposals look at what people will write down as an output, this is an example of what we see. And you can tell already that there are missing elements that you would like to know, right? And so if you would like to know additional information, just imagine what additional information people reviewing your proposal would want. So now let's look at outcomes. And so sometimes we'll see an outcome that's expressed like this, and you can begin to see how there's more specific information now. 80% of the 100 sexually active young adults ages 14 to 19 from South Memphis at XYZ school who were provided a 2-hour training program on HIV and STD transmission and participated in quarterly follow-up visits in calendar year 2021, reported using methods explained in training, and tested negative for HIV and STD during the 18-month follow-up period. So here we begin to see how you're working on expressing an outcome that you can more directly link to an activity you provided or your agency or your team of agencies provided. Now you're going to go into a lot more depth about this, and it's going to become more clear when you have your evaluation technical assistance. So let's say we're going for impact now. So as you can see, the impact statement becomes even more specific. 70%, and somebody has had to measure this now, and that will have been explained in your methodology. 70% of the 100 sexually active young adults ages 14 to 19 from South Memphis at XYZ school who were provided a 2-hour training program on HIV and STD transmission in calendar year 2021 scored 90% or greater on a test for awareness of HIV risk behaviors, reported using methods explained in training, completed each quarterly follow-up visit, and tested negative for HIV and STD compared to 100 sexually active peers ages 14 to 19 from the same school who did not participate in the training and follow-up visits for the 18-month calendar time period. So you can already begin to see how the various levels of evaluation can help prove your case for support. Okay, so now you've completed the proposal. So you've done the why, who, what, when, where, how. Follow the requirements for submission. You don't want to do all that work and blow it at the last minute when you're getting ready to submit. And do a final review. Go back and review the RFP. Have someone else review it. Make sure you told the truth. And there's apps that you can find online called Grammarly and Hemingway, so that, you know, sometimes we know what we want to write and we write it down, but by golly, when we read it 3 days later, we thought, what? You know, because we know we did the wrong thing, because we're so used to knowing what we think we want to say, that's how sometimes our mind and our eyes trick us into thinking that's what we really said when that's not really what we wrote. So those are 2 apps that you can use to check. Also, in a final review, check for typos. Change the size of the font. Even, you know, now you have to make sure you change it back to whatever the proposal requires. But it just forces your mind and your eyes to kind of shift. Sleep on it. Just say you worked all day and all night and you're just so sick of it by this time. Just sleep on it. Read it out loud. Ask someone else to read it, preferably somebody who doesn't understand your work. And so, you know, they're going to be innocents. They're going to try to understand it. And if they don't understand it, it gives you an opportunity to write it in a way where they can understand it. Okay. So after you've submitted, you know, you're going to get a decision at some point, you know. So you're going to find out whether you're funded in full, funded in part, a challenge, or not funded. Highly unlikely that the state will do the challenged, but they might. If you've been declined, whether it's for this RFP or for a grant application you've submitted, do request feedback. Even if people won't give it to you, you certainly won't get it if you don't ask. Ask others to review the proposal that you didn't have reviewed prior to submitting it. They might be able to give you feedback. And obviously, you're going to explore other funding options. Anybody who responds to the RFP, if the work is really important to you, you should be exploring other funding options anyway, right? And so, you know, use basic manners. Tomorrow's another day. Don't offend the people who told you no. Okay, so if it's a challenge, highly unlikely this will be the case, but if you write a grant application, this might be the case. You want to read the small print, check out the time requirements, because they might not give you enough time, right? You want to check whatever the true match requirements. It might be $2 for every dollar raised. It may be a 1-to-1 match. It might be, you know, some other configuration. And, you know, if you think that the conditions are not something that you can actually successfully accomplish, you can say, you know, I have to decline the opportunity to take this challenge grant. I know that would be very painful, but, you know, sometimes that's the most appropriate thing to do. You can always propose another option. They might tell you no, but they might tell you yes, which would be a good thing, right? Obviously, you want to fulfill the requirements and turn in the reports on time and maintain communication. If you're funded in part, You know, obviously you've been exploring other funding options. Hopefully you have them in place. If not, you know you're going to have to hustle. And if you're unable to get the balance of funds or, redirect them from something else you're doing, you can either request a change in scope as appropriate. And if they say no, just graciously accept the decision, and you might just have to walk away from that too. Hopefully not, but those are options to consider. And then funded in full, yay, happy dance. Read the small print. Check the requirements. Even if you're funded in full, you might have to negotiate for changes if necessary. You can also accept it, but make sure that you fulfill the requirements, turn the reports in on time, and maintain communication. So you think, okay, I'm done. Nope, not. No job is finished until paperwork's done. So we got to turn in our reports, right? So as soon as you get that grant, you've reviewed the process for reimbursement if it's applicable. You are going to mark the due dates on the calendar and you're going to follow the requirements and you're going to report what you did. So whether you're responding to an RFP or making a grant application, here's some other options to consider. Who was Willie Sutton? Willie Sutton was a man who was born in 1901, and he was jailed, I think, 11 times or something like that in his lifetime. He started his bank robbing career, if we can call it that, at a very young age. And when he was asked why he robbed banks, he is supposedly attributed to have said, because that's where the money is. So let me show you where the money is for nonprofits. This is from Giving USA. And this is the 2020 report for the 2019 data. The 2021 report will be published, probably summer, fall of 2021. But in 2019, Americans gave $449.64 billion to charity. Look, giving by individuals, 69%, $309.66 billion. So now St. Jude has mastered getting donations from individuals. Isn't that something? 69% of that money came from individuals. So it's the importance of developing relationships, the importance of your individual organizations developing relationships with people who care about your work, who care about you, who care about the people you serve. 69%, that's where the money is. A lot of time is invested in trying to figure out foundations, the government, corporations, but individuals, that's where the money is. Just offering it for your consideration. And this, when you have a chance to look at this further, it shows you exactly what areas it went to. But here's another way of presenting that chart. 69%, that part of the backward C right there, that's giving by individuals. Pretty incredible, right? So I'd offer that for your consideration. And now I welcome your questions. And I can stop sharing now. Okay, no questions. I answered all your questions? Surely not. Anybody? Chat, speak up. Unmute yourselves. No questions? We have time. I whizzed through it so that we would have a full hour to go through this.
Hey, Dr. Young, this is Ray Rico.
Yes.
I have a question. I'm not a nonprofit. I have a marketing agency.
Okay.
And we're in the space where we can help provide digital marketing and services for grants and organizations and collaborate with folks too. So we just submitted a grant for the Let's Stop HIV Together grant that was for the CDC, that's for the Southern region. And I wish I would have had some of this training earlier so I could have kind of enhanced some of what we were talking about. My question is more, you were making some references specifically for nonprofits and the type of, I don't know, like maybe annual reports and things that they might include. How does that differ for a for-profit business when you're submitting like annual reports or information about your company?
Well, for-profits, you have a different motive than the nonprofits. For-profits, you're both trying to get money in some ways, but the nonprofit goes to the beneficiaries. The for-profit, it goes to your stakeholders in the business. The beneficiaries are the stakeholders for the nonprofits. It's equally important, but it's framed in a different way because you're appealing to a different part of the emotion and the intellect in that. And also the annual reports are used differently in terms of reporting to the board and the shareholders and the IRS. Does that help you at all?
It does. I have one follow-up question for that.
Sure.
Too, though. In the RFP process, not just for the End HIV RFPs that will go out, but
Mhm.
I guess nationwide grants and other grants that are available. I think so that I can have clarity, is there a difference in the submission with how you're going to respond to those because of
Yes,
the for-profit
yes,
side?
absolutely.
Okay.
For example, if you, Ray, as a for-profit marketing agency were to come to the foundation, we'd say, we can't help you. And the reason is that you wouldn't meet our eligibility criteria. The way that you meet the eligibility criteria for an initiative like this, or even for grant funding with the Assisi Foundation, would be that a nonprofit eligible recipient of a grant would be contracting with you to provide a service that they see as essential to the successful achievement of their objectives.
Got it.
And
Thank
we
you.
know the importance of social media. We know the importance of being able to tell the story effectively. And that's where your expertise comes in. Nonprofit leaders are expected to be all things to all people and have all the expertise. And we know that that's not the case. That's why we need people like you to be able to tell the story. And also, obviously you're going to be challenged because we're going to make sure that, you're not exceeding market rate. A lot of times, not you, but we have unscrupulous people in the community who think, oh, that's going to be a free and easy grant, so let's just gouge them and charge twice the market rate. Unfortunately, even though we have very few of those organizations in our community, one can upset things for everybody else. And, so I thank you for hanging in there and wanting to help the cause.
Thank you, Dr. Young. I put this in the chat, but I just wanted to share out loud, if you don't have access to the chat, that this is a great time for us to have open discussion with Dr. Young right now. So just as Ray did, if you have some specific questions about the information that she just shared, especially as it pertains to your organization, or even as you have reviewed the EHE plan that's on the EHE 901 site, then please unmute yourselves or utilize the chat box to ask those questions. And we would love to have some spirited conversation about how you all are looking to move forward with the proposal.
I know it's early in the morning, but not that early.
Hi, Dr. Young. How are you?
I'm well, thank you.
Good. It's good to see your face. So I was curious about the tipping point that you were talking about.
Okay.
And so for nonprofits, I know that they can't have so much where they can't use policy influence, where they can't have their budget that much. But I think I missed something about what you were talking about, how much of your budget can be from a grant. And I had that a little bit confused versus how much can come from policy, having from lobbyists. So from nonprofits. Can you speak more to that?
Absolutely. Stacy, it's good to see you. The thing is, with tipping, and we can send additional information about that. It is the IRS formula for the public support test. And so during a 5-year period, they look at the assets and the income of a nonprofit, and they look to see if a grant by an individual donor or funder can actually create a situation of undue influence, as they use the term, over the operations of a nonprofit. And so that can tip you out of nonprofit charity status. What you're also addressing is the issue of lobbying.
Mhm.
There's a very fine line. There are dollars that you can expend for some organizations are advocacy organizations. So a large percentage of their budget will be to providing research, in-depth reports, to provide information. Where it gets tricky and there's still legislation that's confused and debated about is whether or not an organization endorses a political candidate. So those are two different things. The tipping issue has strictly to do with a mathematical formula. The lobbying issue is different. Is that helpful?
Okay. It is helpful, and I don't know, because I'm real novel
That's
at
okay.
all this, and I appreciate you letting me chime in to listen to this. The more that I hear something, I learn something new every time I hear something about all this, and this was that piece today that I learned. So I appreciate you letting me sit in. So thank
Oh,
you.
that's okay. We can go ahead and send additional information on both topics.
Thank you. I appreciate it.
Not a problem. Aisha's promised to let me just overwhelm her mailbox and just send out a bunch of stuff.
Absolutely. And I am going to make sure that those of you who are participating will receive all of the information and resources that she will provide to us today. And then additionally, I just want to jump in and say that we will have an encore of this tomorrow. So if you want to invite some others you may know professionally or personally who would benefit from hearing this training, then send them an email or send them our contact information and we can send them an invite for tomorrow.
Okay, y'all are going to hate me, but I'm going to just be horrible. Is it Tashaka Chambers? Tashaka, do you have any questions? Or are you just going to just hide out on me? I'll forgive you if you are. Okay, Stephanie. Stephanie Davis, do you have a question?
No, ma'am. I'm new to grant writing, so I was just listening to everything.
That's okay. We're happy to have you, and I'm so glad that you were able to join.
Thank
There's
you.
a question
Rosa?
in the chat box, Dr.
Okay.
Young. This is from Ray Rico again.
Okay.
It says, can you talk more about how orgs can collaborate together and maybe offer suggestions on how to make connections? That's a good question, Ray.
Yes, and Ray, thank you for that question. Ray, boards, in my experience and observation of nonprofits, I would strongly offer for consideration that each nonprofit, before getting their boards together, make sure that they've done a good board orientation. So we want the boards to completely understand, like each nonprofit's board should completely understand their nonprofit, right? Before you have them go visiting. And it's okay for, many times executive directors will get around the room, or staff people of an organization will get around the room and have discussions about the goals and objectives or a possible partnership. If you really believe that it could benefit from further conversation and discussion, then the executive directors of those organizations need to get together first, make a decision on whether they're going to invite their board chair or a board champion. Obviously, you want to make sure the board chair knows, and then have an informal meeting of the two board people with you at first, because the boards can be very effective. We had a group of organizations that got together, and when an executive director for a nonprofit goes to Nashville and appeals to the legislatures, they kind of look self-serving. But if you get a group of individuals who are the board members, mind you, not just the executive directors, of 3 different organizations working on the same cause, that gets the attention of the legislatures in a very different way. And we have seen that to be successful. Okay, Stephanie Davis, did I hear from you? You said you were new. Were you the one that told me you were new? Yes, I
Yes,
think so.
ma'am.
Thank you, Stephanie. And Rosa, I appreciate your information in the chat. May I answer anything else for you?
Ma'am, I'm okay. Thank you so much.
Okay, Ray, thank you. And Rashida, may I answer anything for you?
No, ma'am, I'm good. Thank you.
Okay, Randall Sloan, may I answer anything for you?
No, I work with Rico, so he's kind of been the voice for our organization here. Thank you very much.
Well, Randall, keep him straight, okay?
All right.
Nate from Community Walgreens, I don't know how to properly pronounce your last name. May I answer anything for you? Nate, are you there? You must be taking care of a customer. Okay, M. Wade.
I do want to share that Nate messaged me earlier and said that he loves the fishbone idea that you posted earlier. I think it's a great opportunity maybe to just talk about some other related resources that can help with this process.
Okay. Those are some of the tools that you'll get are on those slides. And so anything that you can get that will help stimulate your thinking to begin to ask questions in a different way. Very helpful. M. Wade, thank you for putting things in the chat. I don't know what M. Wade stands for, but I appreciate you putting things in the chat, and I'm happy to answer any other questions you might have.
Dr. Young, it's Marjorie Wade. This has really been very informative for me. I appreciate you. I don't have any questions.
Well, thank you for your participation. Maria, always good to see you. Did you have any questions?
I don't at this time, but it was an excellent presentation. So thank you for the information.
Thanks, Maria. Lauren Buford, may I answer anything for you? Kimberly Trust, may I answer anything for you?
I'm good, thank you.
Okay, thank you, Kimberly. And Friends for Life Memphis. Kim Moss, I think I saw you somewhere. Did I?
Good morning, Dr.
Good morning,
Young. Probably
Kim.
so. I apologize for joining late because actually the state of Tennessee had a grant session at 10 for some new money that they've released. So I had to attend that. And again, if you've already covered this, but I was wondering if you could talk for a minute about organizations collaborating and whether you should encourage a small agency to be an applicant and perhaps work with a larger agency as their fiscal sponsor, or if there's sometimes when it's better for the larger agency to make the application and simply include a smaller organization.
Well, it depends on the priority of each organization, the priorities that are laid out. Collaborations are extremely difficult. Strategic partnerships, strategic alliances are a lot easier because collaboration takes a different level of cooperative effort. In the situation of fiscal sponsorship, obviously the larger organization would have to do it for fiscal sponsorship, but it can work either way depending on who can make the most compelling case for support. And in a true partnership, it's a mutually invested case for support. So sometimes a larger organization knows that they're able to do multiple things, and the smaller organization can really put the specific attention required to a project. And in that case, it would be advantageous for the smaller agency under the sponsorship of the larger agency. In other cases, if there's like lag time in reimbursement and the capacity, the full capacity of the smaller organization might be challenged in executing the project well, that may make sense for the larger organization to be the sponsor.
Thank you.
Absolutely.
Jan, currently Kim is in Before You Ask. That's where you've seen.
Well, you know, he's just hanging out with you just to have fun. He can teach the class.
Oh.
Okay, now let me see. Ashley, you said, have you seen in the past for-profit and nonprofit? Oh yeah, for-profit and nonprofit organizations, Ashley, thank you for that, do come together for grants. And that's because, you know, just like Ray and his partner from the marketing firm, you know, they get together and they can help do the messaging for a nonprofit. So as long as, you know, it's a legitimate price point that they're charging. And I know that some of the for-profit companies will give a discount to nonprofits. And so, yes, that's a match made in heaven if it's the right match and they have the expertise, because, you know, they can, and they have connections that are different, and it broadens the network. And sometimes you can get corporate sponsors, you can get people on your board. So yes, if you work with the right for-profit agency, Ashley, it can work. Okay, Denford Galloway, did you have a question I can answer for you?
Good morning. No, ma'am, doctor. I'm just glad to be able to listen to what you have to teach us today.
Well, happy to have you. And Dwayne, may I answer something for you?
Not in particular. I think you definitely met my expectations for the knowledge you shared. Thanks.
Uh-oh. Well, that's good, I guess. And DeMarcus Jones, may I answer something for you?
Yes, Dr. Young. So I co-chair a smaller organization here in Memphis called the Headliners Memphis. And so we're moving towards board development as we're moving towards 501c3 status. And so I wanted to know what advice and suggestions would you give us as we're starting to recruit board members?
Tell the truth. Always tell people the truth. And one of the first things you want to hand a board member, DeMarcus, is the Tennessee Attorney General's Guide to Nonprofit Boards, because they are accountable and fiscally liable for how your organization operates. Also, make sure that you set expectations very clearly on the front end that they have to give or get. And so it doesn't come to them as a surprise that they have to make a financial contribution in some manner towards your organization. And make sure that you have outlined everything clearly so that you can really orient your board. The other thing is, try not to have a family member as your first board chair, please. Family members shouldn't be on your board anyway, because they may not have the strength to fire you. And so we don't want that situation to occur, because once you decide those things that you're going to be accountable for, we expect the board to govern appropriately. The other thing to remember is board members need to understand that they have a governance responsibility. You as the executive director will have a management accountability for your staff and the operations of the organization. So that's another important distinction that you can make very clearly in a good board orientation. But telling the truth and getting people who are committed to your vision and your cause is one of the best ways to recruit. But making expectations clear so they're not disappointed in you and you won't be disappointed in them later on down the road. But there's a whole session of that before you ask if you want to hang out with us there.
It certainly is. Can you give us like a quick overview, Dr. Young, and you as well, Ernestine, of what the Before You Ask courses are? I've said it a million times. I've taken them, and I think it's a great opportunity to share with everyone who's on the call what the course is, and they may see benefit of joining it.
Ernie, I'm going to turn that over to you because you just love to talk about Before You Ask.
I sure do. Before You Ask is a 12-week cohort, which is a long commitment, we realize, but we make it worth your while. We meet for 12 weeks, 2.5 hours a week, always on a Thursday. In the spring and the fall, we have morning classes that meet on Thursday morning from 8:30 until 11. In the summer months, which actually we've already begun, as soon as daylight savings time begins, we do the evening class. That class meets on Thursday evenings from 5:30 until 8. Each week we have a different topic, and the topics build on each other. For instance, the first week we talk about what is your mission statement? What is your core business? What is your vision that your organization wants to see change in the community? The second week we talk about how to identify a need in the community. Then the next week we talk about how to meet that need, how to read a budget, how to understand your 990. Everything financial. Then we talk about how to build your board. Do you have an orientation process for new board members so that they know what they're getting into? Do they realize they're financially responsible for your organization should you have to close down? Then we talk about how to do a strategic business plan and what that means. We have a week of ethics training, which we think is very important. Dr. Jan teaches grant writing. We have a session on fundraising. We have a session on how to collaborate with others. We have a session on what are your next steps and how do you make your elevator speech so that you can tell others about your mission and your vision and get them interested in contributing to your organization. The very last session is called Ask Dr. Jan. And you can ask Jan any question and she will give you an answer from a funder's point of view. And Jan doesn't like to toot her own horn, but she has her doctorate in nursing. She is a retired 2-star general in the Air National Guard, and she has a wealth of information as the COO of several hospitals in town. And she has a unique perspective on so many things, as well as especially the nonprofit community. So you get a wonderful opportunity to get information from Jan on 2 sessions. And then Bridget and I try to make it very interesting to do all those other 10 sessions. So we would love to have you attend if you're interested. Right now we're in the summer session and it's full. I have seats in the fall session, which begins August the 5th and runs through October the 21st. And also in the spring session that will begin in January and run through the 1st of April. And our next evening session will begin in April of 2022 and run through the middle of June. So if you're interested, all you have to do is shoot me an email and I'll hook you up.
Thank you so much, Ms. Smith and Dr. Young.
Thank you. And Daniel, I got your message. And Stephanie and Daniel, thank you for being 2 new TTS champions. We really appreciate that, and very good luck to both of you in the charity and Robert Wood Johnson grant. So thank you for doing that. And I know that Lucy did a great job in what she great.
She did an excellent job. Excellent job.
I'm so glad you were able to participate. Brooke asked you, do you have any questions I can answer for you?
Hello, none at this time. Thank you.
Okay, Brooke. How about Angelette? Might I answer a question?
No, I don't have any questions. Thank you.
Okay, Amber? I don't know how to pronounce your last name correctly.
That's okay. Thank you, though. No, this was just a really brief introduction for me. I work here at St. Jude, but I'm also a grad student at the University of Tennessee in Knoxville, and was actually going to be taking a grant writing class next semester as well. So just trying to get as much exposure as I can to the verbiage and then also working with a lot of grants here. I just, want to be more knowledgeable. So just really listening in. This is a great introduction, and thank you so much for your presentation today.
Well, thanks for your participation. Now, Eddie Wiley, where are you? Eddie Wiley.
I'm here.
Okay, Eddie. I want you to be kind in writing that request for proposals now.
Of course.
And so be kind to our Memphis applicants and from our planning group.
Definitely here for Memphis. It's exactly the reason why I came back. So we're looking to get the resources out and make it to where we can spread the good wealth of the money that we did receive. So this was awesome. I am so appreciative for all of the nuggets that you gave today.
Okay, Eddie, since you're going to be writing the RFP, I know this is not fair, and I know I'm putting you on the spot, but what other things should I have focused on in order for people in our group to be successful responding to the RFP?
I think this was an awesome overview of what is going to occur as well, because you touched on every topic of evaluation and collaboration and thinking about the pillars and being very responsive to the actual End HIV 901 plan. So we will be, we have the possibility to continue another series of trainings as well once the RFP is released, or even before the RFP is released, for more specific things. But this was great because it certainly covered all of the topics that are really important to the innovation and strengthening those proposals for those innovative programs that we're looking for.
Thank you, Eddie. And I do want to share with the group, Eddie had mentioned that he was looking for unique ways that people were going to do things. And, that maybe is not typically considered, that he would be open during an RFP process to look at unique ways that people are serving the community of people living with AIDS, so that we can really address a lot of those determinants that you have on your End HIV 901 page. And so as you're waiting for the RFP, if there are some unlikely partners that you can think of, people that you've referred to and like someone had said, mental health providers. Okay, are there different individuals? There was a group doing some research in one of the organizations, and I'll have to look up which one that was, but their expertise was specifically targeted for the trauma experienced by people living with AIDS. Might that be an agency that you want to work with? I'm not saying that you should or should not, but this might be the opportunity to really look at that plan and see your unique niche, or maybe reaching out with the help of Randall and Ray, for example, to say, okay, how can we communicate this message in a nice way to reach the children who are at most at risk because of their behaviors, or the young adults? What can we do in order to reach the community, not only for prevention, but having people in the community support people living with AIDS in a much more positive and transformative way for our community? So this is an opportunity. And I know that many of you get frustrated when a funder says, I'm looking for innovation, because, you have time and tested methods that have worked. But the push for innovation isn't to discount your tried and true methods that have worked. It's like, how can we accelerate those tried and true methods? How can we leverage those tried and true methods in a way that we can make things move more quickly or get to effectiveness faster? So please don't be discouraged by that and thinking that, oh my goodness, I'm going to have to think of a brand new project in order to get the grant. No, you might have to find a way to improve what you're doing in a unique way, or develop another partnership, or like if you look at those, when you look at the slides and you look at the atlas that was that is published for the demographic data by geography and the GIS mapping, what are the disparities we have to address? And yes, you're doing excellent work. And yes, the agency you're partnering with is doing excellent work, but what can we do to make this better? That's kind of the way that I see the innovation that they're searching for in this work. Okay, initially I was told 90 minutes, and then I was told that I could have the full 2 hours. And so I do want to be available. I know that all of you are very busy, but I do, want to be available to you to respond to anything else that you want to ask about, anything in the slides that you want to go back to or want more in-depth information about. Kind of like when Stacy said, hey, talk a little bit more about tipping, talk to me a little bit more about advocacy, lobbying, and policy. So anyone, it's open. I know that you're not a shy group. You can't be shy doing the work that you do. So come on.
Dr. Young,
Yes.
this is Aisha. So one thing I distinctively remember when taking those sessions before you ask is that it's very important to not identify one source and one grant for the funding to sustain the nonprofit organization. So can you share with us the importance specifically related to just not going for only the EHE funding that'll come out in June, but also going for other related funding to support the activities and potential implementations of the strategies that they may be seeking to go for?
Yes, because any funder may not have the wisdom to see the beauty of your request and the, logic that you have in your well-planned strategy. So you want to make sure that if it's important enough for you to go after EHE funding from the state, then it's important enough for you to fund for your day-to-day operations. So that's why, develop the relationship with donors. Here's where marketing people and others can help if they have the skill set to do that, is to reach out and develop your individual donor base. That individual donor base can help you when nobody else is around to fund you. The other strategy that you can look at and explore is earned income. Now that's really hard to do, but think about it. It's called social entrepreneurship from from the IRS. And so that means a nonprofit is allowed to have a for-profit business. The difference between the business that the nonprofit owns and a for-profit owns is that all the earnings from that for-profit agency owned by the nonprofit goes to support the nonprofit agency. So one of the early social entrepreneurial models was an American Red Cross chapter in Minnesota. So that Red Cross chapter had a durable medical equipment store. So they sold wheelchairs, hospital beds, canes, walkers, prosthetics, et cetera, all the proceeds from that store supported the, of course they had to pay for the business, but it supported the nonprofit Red Cross chapter. So let's, all of us on the call today, let's be thinking about what is it that many people living with AIDS need in our community? Is there some place that we could, is there a service or a product or a group of products that we could provide for people living with AIDS in our community or people who take care of people in our community? Could we create a cooperative? I'm just making stuff up now. I don't have a business plan for it. I have to work on that. But is there something that you collectively, you've got great minds in the room, can create where you could actually continue to support the work of nonprofits? There's a lot of talent in our community, so And the people who love the people who are living with AIDS, is there something that you can do for them that, you know, that they would be willing to pay for, that could help support a for-profit enterprise that could help support your work? So, you know, you know, if Eddie said, think of something innovative, think of something creative, that's worthwhile, right? If you could get the magic formula, you know, not only to support maybe one organization, but to support more than one of you. Another thing is not direct funding, but if you look at all the agencies represented on this call today, all of you buy paper products, right? All of you have some product that you buy for your particular agency. You know, most of you know about value analysis and value-based purchasing, right? What if you decided to say, okay, there's 40 providers of HIV, you know, 40. Now, I know we can't count St. Jude because St. Jude is an entity into their own space, but particularly with the smaller agencies and agencies that are not as large as St. Jude, what if you went to the people who provide paper products and say, hey, unless you can give us the very best price on the paper products, none of us will buy from you anymore. You know, but guess what? If you decide to give us the most fair price on paper products, then all of us will buy from you. Right? So that's how that's a lesson we can learn from the for-profit sector, where they leverage relationships and agreements to get the best pricing for things that you have to buy. So it's kind of like creating a co-op of sorts. So, you know, different ways of looking at different things to create savings for you or to create revenue for you, in addition to learning more about different organizations. You know, for larger grant applications, you have places like the Gill Foundation who would be open to considering grants. But, you know, just make sure that you have the criteria. We have and when we do our budget discussion, we have a key stats discussion in our Before You Ask program. It is a way of analyzing your 990 that we know national funders use. They probably don't use the exact tool that we use and that we teach in our class, but we do know that national funders look at the ratios that we teach you how to calculate from your 990 in our class. And guess what? If you don't meet a certain threshold, they're not going to look at your application. So we want you to be prepared with that kind of information when you go into that arena, so that you'll know that whether or not you're going to get a fair review or not. But it's all about building relationships. Corporations in our community that might be helpful. Getting the right messaging. So if you have somebody, if you're working with someone who can help you tell your story effectively, you know, I don't need you to make everybody cry with an ad, but we need people to be inspired to give with an ad. Nobody wants to see one more dog that's being abused so they can go cry. We want to, you know, we want to be inspired to give. And not just because there's a disaster or a mass shooting or somebody got beat up inappropriately. We want something that's sustained and something that will connect people with your work. You know, wouldn't it be great to end HIV? Man, but you know, we should be able to get everybody excited about that. Right? So find the right message to connect with everybody. What is it that's at the core of the human experience that makes us all want to do that? So, you know, I mean, I know that it's easy to get $1 at the grocery store, or, you know, even, okay, let me tell you, like Goodwill. Goodwill is the master at rounding up, right? You go into Goodwill, and I invite you to do that. It's safer now to go into the thrift shops. It's my retail mental health therapy. You know, we all have to seek different ways of taking care of our mental health. And so when you make a purchase at the Goodwill, what they'll ask is, would you like to round up? Salvation Army does that too. And you know, if your bill is $14.96, you pay $15. Okay, so you got a good bargain. And you only donated 4 cents, but of the 1,000 people who came in, you know, some days you go in and you round up to 4 cents. Some days you may round up 96 cents. But it doesn't feel, you don't feel hurt by making that contribution. You can feel good about your purchase. So you win both ways. You get a great deal. Like Ernie went in and found a Waterford toasting flute for $1.99. It lists on eBay or on the website if she bought it new for $99 or something. I don't know. I mean, maybe $199. Who knows? But anyway, that's a deal, right? So you can feel good about that. So she didn't care about rounding up. Why should she? I mean, she just paid less than 10 cents on the dollar for the thing that she bought. So I don't, you know, there are different ways of reaching out to people where people can feel good about giving, whatever it is that you can find in order to make that happen. That's a very cool thing.
Dr. Young, that was a great example, and that reminds me of the importance of fundraising. So I know that we talked about before in that class how we should incorporate fundraising yearly or annually, and we should definitely get our board to help and assist with that. So I know that we don't have a lot of organizations that do this type of work that focus on fundraising. So can you just share a little bit about the importance of fundraising and how that can be a supplement to the funding that we all want to make sure that we sustain?
Absolutely. Fundraising is so very important, and grants and responses to proposals are only a small part of it. Every person who works with a nonprofit should be a fundraiser, only because you represent the organization. It might be in the grocery store, it might be wherever. You know, people know that you're associated with something that's important to you. Well, you know, so you want all your staff to be happy about being there and wanting to support your agency, because you don't know what might be said to someone that you don't even know or think is paying attention that will help you further your cause. That's why elevator speeches are important. You should be able to say in 60 seconds or less what you do. If it takes you 3 minutes to get out what your core business of your organization is, you have missed an opportunity, because you know the time that you get on an elevator and the time that you get off isn't very long, right? So that's why we call it an elevator speech. And you want to be able to concisely communicate your message to get something that's important. Don't be afraid to ask. Anybody can ask. You know, some people will put pebbles in or pennies in their pocket. And so sometimes, you know, there are some people who give you 10 pennies as an exercise and you put it in your left pocket. And so every time you make a request of somebody, you take 1 penny out of your left pocket and put it in your right pocket. By the end of the day, you should have 10 pennies in your right pocket. It doesn't matter if the person did not honor your request or give you what you asked for. It's to get you conditioned to being able to make the request. And so sometimes it starts out that simple where you say, okay, I don't have that much courage. I must start with 3. So today you might ask 3 different people to make a donation to your organization, whether it's a stranger or a friend. And hopefully by the end of the day, you have 3 pennies in your right hand pocket and you've got 3 different checks or 3 different pieces, amounts of cash that you can put into your organization and celebrate it. Celebrate those small victories. You know, sometimes we're so busy. What is it that somebody said to me? Sometimes people are so busy chasing the nickel, they stumble over the quarter. And that frequently happens because they're so busy going after a shiny object that they think they might be able to get, and totally miss the opportunity for the relationship and the donation that comes. For galas and things like that, they're very important. The pandemic has taught us a lot of things about galas and things. We've never been a fan of galas and rubber chicken dinners. That works for some people. But you know, sometimes those galas and rubber chicken dinners cost more money to put on than you raise. So if it costs you $20,000 to get in $22,000, was that really the best use of your time? You know, you made $2,000. I bet you could have figured out a different way to get $2,000 a lot cheaper, but you may have built relationships and you may have created a different network by having that rubber chicken dinner or a gala. So, okay, if that's the case, that's all right, but be very clear about what you're doing and how you're doing it when you do fundraising. Also, please be looking for momentum nonprofit partners to do the next announcement of the Jumpstart program with Network for Good. We do underwrite that, and it's for smaller organizations, and they will connect you with a fundraising coach if you get selected for the next cohort. And for those people who did work the plans and worked with the Jumpstart coaches, all of them increased the amount of revenue that they were able to raise in the year that they participated. And the majority of them are in their second year cohort now and doing very well. And I can tell you the quality of the messaging from those organizations has improved immeasurably. And when people want to continue to do the work, we know that it's successful, or else we wouldn't continue to help sponsor it. Did
That
that?
was great. Thank you. Yes, it was perfect. And you all, I'm asking these questions because one, these are things that I've heard from you all just over the years actually of the planning process for the EHE plan and while we are in implementation. And then also I'm kind of just getting you all prepared for the sessions that are to come. So we will have sessions that will speak specifically about fundraising and budgeting and evaluations and even the board. You mentioned momentum, and we have someone who is a representative of them who's going to give us a short oversight about some of those topics, and I'm grateful for that. I also see that we are kind of depleting in our number and we are close to the 12 o'clock hour. I want to thank everyone who has participated and attended today. I know that the information was fruitful. I hope that it was fruitful for you. I've gotten messages throughout this time, Dr. Young, that people are saying you are amazing, that you are very straight to the point. The information is clear and concise. So we are so grateful for you. And if everyone could just show us your camera, if you are camera ready, and just give a silent hand clap to Dr. Young and Ernestine. We are so grateful for the information that you all have provided today. We look forward to hearing this information again tomorrow. Again, if you want to join us tomorrow, join again. It'll be pretty much kind of the same information, right, Dr. Young? Is that correct?
Yes, ma'am. Yes, ma'am.
Mhm. And I know how when we walk away from things, we're like, oh, I forgot to ask this, or I want to ask a question about this. And I can imagine that tomorrow we'll have more open forum to have those discussions and talk in more detail about some of the activities that you all want to go for in terms of the funding. So we are near the lunch hour. Again, I'm grateful. I'm thankful. We have 5 minutes left. So if you want to hang out and ask some more questions for the next 5 minutes, please do so. And if not, then you have the full autonomy to go ahead and let go of this call. But I thank you so much, and we'll be sure to give you all the information and the resources that she provides for us soon. So thank you.
Yes, and please remember, if you are not on the listserv for End HIV 901, go to the website, nhiv901.org, sign up for the listserv. We will be announcing those opportunities as well as the EAP Advisory Board. And don't forget to follow us on social media, Twitter, Instagram, and Facebook at End HIV 901.
Again, thank you for letting me sit in. Y'all have a great day, and I hope to see you tomorrow.
Thank you. Great questions, everyone.
Oh, and Ernestine, I obviously have to go thrifting with Ernestine because
Right.
That's right. Hey, you know,
I'm good, but Jan is the master. Jan is the master.
it's great therapy.
I wish I was good at it. I don't have the patience. I need to acquire the patience for it.
Well, I found her a Wilton Armital tray, grape and IV pattern for 30% off of $2.98. List on Amazon for $40.
She's unbelievable. I have told her before, I sure wish I had one of those Ralph Lauren black blazers with a crest on it. 2 days later, I had one.
I want that. I want
We need to know where your secret thrift shops are.
I
All
hit
of
all of them. You know, you just kind of
Right.
scan the, and I know where all of them are all over town.
She does. She knows them all, and she frequents them all.
And I know which days they have the senior citizen discount. Thank you.
Screaming.
The military discount. So I take advantage.
Are you near?
Half off for holidays. Yeah.
The half price, the 50% holidays.
She's even turned John Mansfield into a thrifter.
That's right.
Director of First Impressions that wears all the gorgeous jewelry. She's turned him into a thrifter.
Turn me into a thrifter. I'm ready. Turn me. I want to be a part of the journey.
Oh yeah, it's fun. We'll just have to take you when things are more relaxed a little bit. We'll just take you and say, okay, what is it that you want, and tell us what your budget is. We'll turn you loose.
Thanks. I think the 3 people that are still on, they probably stepped away from the computer. So I just wanted to share with you all that I think this was amazing. And I really don't have anything to share that I would want you to do different for tomorrow. What you have provided is very strong. If you just want to take some of the questions that was asked to just, address it on the front end tomorrow, feel free to do so. But I know that the things that you all talked about today was very, again, fruitful, and people were appreciative. And I got a lot of text messages of like, this is amazing. This is on point. And even Eddie said, this is great. So I am good with what you presented today. Eddie, if you have something else to share, then please go ahead. Me and Eddie, we work very closely with each other. So go ahead.
That was amazing. It was simply amazing.
I'm so glad.
Yes.
And Aisha, after the RFP is released, if we can work out something in the schedule, if you think people want some really direct focused technical assistance, happy to provide that.
Yes, absolutely. So I have an email ready to go out to just thank everybody and remind them that we're doing it again tomorrow. And I added in that email that you shared with me last week that we could, work with each other for after the RFP. I'm confident that we'll need that. So, and I don't know, Eddie and I, we're working on, and we probably should talk about this later, but Eddie and I are working on the EHE advisory board. And one of the things that one of the, I think, representatives from Southwest, and Sherry can be more specific about it. I just say, Sherry, hey, this is the person that I want to do this session and share with you. Sherry said, okay, I'll contact them. So she's been amazing with that. But they're going to do a presentation about just how to operate as a strong advisory board. And I think that for session 1, obviously we'll go with them. But I think it'd be good for session 2 if we could have you all to come and talk about some information as well to continue the momentum of a strong advisory board. They will be a part of the deciding process, and that was really important from the community. They didn't want to feel like we were just using them to get the initial plan created, developed, and sending it off to the CDC, but they wanted to be a part of the full process, which means implementation as well. And we thought that it would be great if we got some of the members who are qualified and interested to sit on the EHE advisory board, assist with reviewing some of those proposals, and then they will be able to speak towards those organizations and individuals who they know are willing to do the work, have the capacity, or even be honest and say, I don't think this is best right now, but maybe we should go a different route with them. So I think that's a great topic for us to talk about and discuss once the RFP goes out. What do you think about that, Eddie?
I think that's awesome because it's definitely needed, because when we set out, like when I first came on the team, the big thing was community involvement and hearing the voices and not just receiving that information, but using that information. So, and also thinking about the fairness, so compensation for their time or all of the resources that they have to utilize to get to our meetings. How can we make it easier for them? So I think all of that is really important.
What I would like to request is when you release the RFP, you go ahead and release the scoring criteria at the same time so that everybody's clear, including the, whoever's on the advisory board is going to clear how they're going to measure it so that it takes less subjectivity and levels the playing field for everybody.
Sherry, you can stop the recording too. We don't want to put this part out there.